at critical mass. Kevin, if you would like to get us started.
All right, I will do so. So welcome everybody. It's good to see you at the beginning of 2021. Let's cross fingers and hope that this has a much better year in store for us than 2020 had. But I believe we will always look back at this time and say that, wow, we persevered, we got through. As hard as it was, as hard as it may be in the future, human beings are survivors. And that is what we best know how to do. I was fortunate enough to receive my first COVID vaccine about 2 weeks ago, and I felt completely fine. I had a bit of a sore arm, maybe double the amount of a sore arm compared to what I would usually do with the flu shot, but no other side effects. And I've been pretty impressed with the science behind these current vaccines, but there is the large unknown ahead of us because we don't know how long immunity will really last for after vaccination. So we may need to look at the data after this and see, do we need booster shots, et cetera? Are there variants of the COVID virus that are changing that we need to quickly look at new vaccines? But the technology with this new vaccine was just simply amazing. What a time to practice medicine. Very exciting. So my wish for you as well is that you stay healthy, that you take care of yourselves and your families, and we will get through this. Today, we're hoping to have as brief a meeting and as robust a meeting as we need. So we're going to do welcome first to everybody, go through the agenda, which is reviewing the final recommendations that were sent out by Jeremy and Sarah. We want to make sure that we look at the feedback that the committee members had given. Also, make sure that the comments that we gave back have been addressed accurately in the final document. Then we are going to need to approve this final recommendation as a group. And then we will move to next steps and closing comments. So this may be a quick meeting. This may be a very robust meeting. We'll see how we get through this together. So to kick it off, Sarah has been taking documentation of the attendees, so we don't have to specifically do roll call, but we'll move to the point now where we do need to have an action item of reviewing the December minutes, and we can approve those by consent. So the December meetings were sent out. Were there any clarifications, changes, or other recommendations for that December meeting? So hearing nothing and seeing shaking heads no, I'm going to say that we have approved those as a consent group. And we'll move next to have Jeremy talk us through the review of the final recommendations that were sent out. Jeremy.
Great, thanks, Kevin. And I'm actually going to kick us to Sarah in a second, but want to cover what you have in your inbox. So we received feedback from, I don't know, it's fewer than half probably the committee members. Received a number of folks who said things were fine as is. Received some robust feedback from some folks and didn't hear from some of you. So we tried to capture everything we've got in a summary document. Some of that did trail in a little bit late, so we weren't able to get you a full red line of the entire report, but have a red line of the recommendations, which are really the meat of the decisions. And then the summary also captures where we'll make some tweaks to the final report as well. So I'm going to have Sarah summarize the changes we made to the recommendation, some of the other feedback we received, and then we'll have some discussion and are looking for you all to hopefully vote to approve the red line version of the recommendations and the final report contingent on those other changes that we'll make that are captured in that summary document. So with that, let me turn it over to Sarah.
All right, we want to talk about the recommendations and summary. We sent out two versions, one red line, one clean. Most of the changes to the recommendations themselves are very minor. Overall, there's a little bit of language tweaking to make them consistent, consistently framed, so sort of OHA shall, the program shall, versus the committee recommends that OHA shall. So some minor language cleanup. We also clarified some of the language to better distinguish between measuring total healthcare expenditures in recommendation number 1 and measuring total medical expense, the provider level measurement, in recommendation 4. So a little bit more cleanup and definition there. We added a footnote to recommendation 4 about the provider directory. One of the pieces of feedback we got was that folks may not be familiar with the provider directory and that statement needed just a little bit more context. In recommendation 7, we clarified that we're using primary care attribution, a primary care attribution model, and that is discussed more in depth in the report, but we hadn't called that out anywhere in the recommendations itself. We cleaned up the language a little bit around taking action and the VVP compact to align with where everything landed. No major changes to the content there, just the language. In recommendation 15, one piece of feedback we received was that in addition to the unintended consequences and the monitoring for negative impacts, we should also explicitly call out positive impacts of the cost growth target, as there might be some positive impacts on certain populations or certain regions or markets, and we didn't want to lose sight of the positive focus there. Then in recommendation 18 at the bottom of page 4, we added a bullet point about escalating accountability at the market level, but taking overall performance into consideration. So this is that last remaining decision from the December meeting that we had talked about. This is reflected in the December minutes as well, but it had not been in the recommendation summary prior to the December meeting. A little bit of cleanup at the top of page 5, again on language, just to clarify the double fining and how that works for an integrated entity. And then I think everything else is just language and just small tweaks for cleanup and consistency. But are there any questions or comments or concerns about the red line to the recommendations?
Yeah, sorry, hey, Jeremy and I were just chatting about number 19 there and the change of OHA will to should work with DCBS to ensure a financial penalty does not create a separate regulatory issue. I would appreciate hearing the reasons for the change, and just want to point out like that probably should remain a constant communication. You know, there might be some other aspect to it that we can address, you know, as far as whether a financial penalty and anything else, but that's one coordination issue that should probably remain.
I think that was just because all of the recommendations were reframed from will to should. I don't think that was anything specific about the DCBS OHA relationship, but does anyone want to clarify?
I don't have any, from speaking on behalf of OHA, I don't have any issue with us changing this back to a will to just clarify that we want the really strong connection between the agencies if folks support that.
Is everybody else okay with that minor change? I think it speaks to the intent of that recommendation.
Okay. If no other comments about the red line, I can talk about the feedback that we intend to incorporate in the final report next. Are we ready for that?
That'd be great.
Okay, so you have a separate document, summary of feedback on draft recommendations, and it goes through section by section and is a mix of copy edits, small clarifications, and places where you all thought we needed to add a little bit more nuance or something from the discussion was not fully reflected in the report. So let me go through this. We have 2 cover letters that we'll be adding to the front of the report, one from Jack and Kevin as your chair and vice chair, and one from the Oregon Health Policy Board. The Oregon Health Policy Board voted last week to support these recommendations, and we'll have a letter that goes along with that. For the introduction of the report, we want to add a definition for integrated system. Some folks, again, just making sure people knew what we were talking about when we were talking about integrated systems. Cleaning up all committee member positions. We had some errors in how you were all listed. The footnote explaining the Oregon provider directory, that's the same as in the summary document. And then clarify that we're using cost and spending interchangeably. In the cost growth target section, if available, suggested that we add some historic spending growth data for Oregon for context. We currently have national growth data in there for context, but not state specific. So just fleshing that out a little bit more. Adding some more detail about why Oregon doesn't have self-insured data so that it doesn't look like we're being lazy or incomplete on purpose. Add some clarification about the TRICARE health coverage program, as folks might be less familiar with that. We have several comments about adding clarification about the Medicare data and what we would be including. So Medicare Advantage versus fee for service, and whether we'd be getting that from payers and from CMS. So we'll build out that section a little bit more to be clear that we do intend to request the data from CMS and that we will have a broader Medicare population reflected in the measurement. And then some clarification about aggregating data across payers and adding language about the impact of bad debt and financial assistance in the discussion of the allowed amounts. Any questions or comments about any of those recommendations so far? I see thumbs up, thank you. Okay, continuing down the list, in the data use strategy section, there was a suggestion to add some more detail about work that the technical advisor group would be taking on around data collection methods, cost drivers, and variation in cost growth. In taking action section, there was a suggestion about adding more detail to make sure that VBP efforts do not interfere with transparency around transparency to medical costs or comparability of costs with reference-based pricing programs. So we will add that. In the quality and equity section, we have some updates. Some of the tables that were comparing the other state programs. There have been some changes to Delaware and Connecticut since we drafted this report, so we will update that with some new information from Michael. We will add detail about the potential data sources for population analysis. I think the feedback here was that we're talking about population analysis, but not being explicit if this is data that that payers would need to submit, or analysis that we expect payers and providers to do, or if it was something that would be part of the state strategy. An additional consideration for unintended consequences, to not just think about unintended consequences for consumers, but to also think about unintended consequences for employers and purchasers. Again, the comment about looking at potential positive impacts as well as negative or unintended consequences. And then a discussion about what success looks like from a consumer perspective. So we reference consumers a couple of times, but we don't really build out what we mean or what that could look like. Any comments or concerns about those? Okay. On the second page in accountability, again, a little bit of cleanup of our references to other state work. Clarifying the double fining language, same as the recommendations, clarifying where we need to develop additional details. So what happens to any financial penalty funds that are collected, and some of the other things that we had flagged in December as needing additional discussion. The added bullet about escalating accountability at the market level, adding some more emphasis to collaboration, adding emphasis that PIPs are the continuation of that transparent and collaborative process, adding language about OHA investigating the use of third parties as part of that PIP process, adding some nuance to the impacts on solvency discussion. So currently it's stated that the financial penalty should not create or not result in any solvency problem. And the feedback here is that this program shouldn't guarantee that essentially a flagrant offender of exceeding the cost growth target should remain in business. Clarifying the size of the financial penalty and how that calculation will be developed, and adding detail about where DCBS will be involved in those conversations, so it's not just an OHA-led process. Any comments about the accountability section? There's a lot in here.
Yeah, I have I guess, so the size of the penalty is something we spent a lot of time talking about last time, and it's not really in here right now. And so I'm assuming that there's a reason for that. I think sort of the cascade of events here is that hospitals and health systems sort of see this, they start to make decisions that's going to affect kind of what spending is 3 or 4 years down the road. So what's the what's sort of the one sentence signal to the CFO who wants to know, is the penalty worse than than sort of ignoring this? So when do they start to get information about the size of the penalty?
Well, I think, John, it kind of a little bit out for me, so maybe I didn't fully understand your question, but I think you're trying to figure out kind of when are people on notice of what the penalty could be and the timing of it and when it's actually implemented.
Yeah, a little bit. I mean, I think there's sort of there's a few things that have to happen, but I guess, going back and I forget, there was somebody else who was sort of, skeptical that organizations would or that organizations would balance kind of the size of the penalty against sort of the ignoring the cost growth thing. And so I think I guess in my head I was imagining the OHSU CFO wanting to know, is the penalty $100,000 or $1 million or $6 million? And so I think, unless I'm missing it, it's not really in there right now. And so when does that happen, or how does that get communicated?
So I think if I interpreted the conversation in December correctly, we didn't land on the actual size, but more some principles and parameters for what that would be, and it would be variable based on essentially the size of the organization. So I think there does need to be some additional discussion, and we have that sort of shortlisted for early 2021 about sort of what is the base rate. Is it essentially a flat rate per member, and then that scales, and then you can calculate what that might look like. But we didn't actually land on what the dollar amount would be. So I think more conversation needs to happen in 2021. I think, John, if I'm hearing you correctly, you're saying we should also clarify when that decision will be made so that it's not just left lingering.
And I think, so what we heard in December was it's a percentage of the amount that you're over with a whole list of factors of going up or down from there. We would need legislative authority for that, and we need to go through a rulemaking process as well to clarify that, which would be part of what next steps that would happen in 2021.
Are there other questions or concerns? I think, John, to your point, we can make sure we're adding a little more language about the next steps there.
I also, this is Lisa, just jumping in here. Sorry, I'm finishing lunch, so I'm trying to be a good Zoom participant and not eat on video. It's not being super successful. I think one of the things that Andrew mentioned is the flexibility and the need for the flexibility that DCBS has with that. And so if we're going to add the next steps with the John piece, I think that might be worth capturing the outline that Andrew had in the last meeting as part of that.
Great.
If not a problem, we can definitely include that. I think that captured a lot of the intent of the different elements that we would consider in terms of what a financial penalty would look like.
Okay, let me run through the rest of the changes we plan to make. So for governance, suggestion that we clarify that the successor committee in 2022 and beyond would include business and employer representation. We had explicitly called out consumer representation, but not business and employer, so adding that back in. In the appendices, clarification about risk adjustment and how risk adjustment works with the statistical testing methodology. And some actuarial feedback on our assumed covariance of spending between consecutive years. So we will note that we need some more discussion with the actuaries who provided those comments, but that also might require some additional discussion in 2021. And then we also have a letter of support for this work from Milbank and their support programs for states that are doing this work. And then we have a bunch of copy edits. Thank you all so much for reading this with a close eye. So essentially assuring consistency and consistent language and a little bit more cleanup to the text and the formatting. Any other questions or concerns about these changes?
We're getting
Quick
a
question.
the general thumbs up. I see the thumbs up from Felisa and Andrew. Everybody else feeling good about this?
Yeah, this is Jordan. Just a quick question. How does the legislative process work for some of the things that we need to get approval for, like penalties?
So we have a placeholder bill that we had filed as an agency bill, and then we've submitted the accountability framework for an amendment to be drafted. So don't have that back yet, but that's we're anticipating a bill that would, in essence, basically just capture the accountability, the framework for the accountability piece, and we would intend to keep you all apprised as that moves through the process this session.
So does it seem like that should be an attachment onto the final report and something we may see in the next meeting?
Just drafting time-wise, likely, we want to get the report into the legislature within the next week or so. We don't really have control over when they finish drafting an amendment, so I think we can keep you all apprised as we get that, but the timeline's a little out of our control.
I think there is a place in the report where we reference the placeholder legislation, but I think bills dropped on Sunday, so we can add the actual bill number, but that's probably as far as we can go because the amendment's not out yet, as Jeremy says.
Yeah, I think the number would be helpful so that when we look back on it, we can actually find the bill. Thank you.
Yeah, absolutely. And I'm happy to keep this group apprised as when we get an amendment back and as things evolve through the legislative process.
So Sarah and Jeremy, is there anything else that we need to walk through before we look at having a approval of this final recommendation?
I think if there isn't further discussion, I think we'd entertain them, or would like to have a motion to accept the recommendations and accept the final report with these changes.
So I guess first I'll ask if there's any other comments, questions, clarifications that we need to have from what Sarah and Jeremy have walked us through thus far, and open it up there. And seeing nobody jump in, would somebody like to make a motion to approve these final recommendations?
I'll move that we approve the final recommendations with the changes discussed.
Thank you. Is there a second?
Second.
Great. And for this, I am going to ask for all in favor to say aye, and then any opposed to say nay. So all in favor, please say aye.
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 Opposed. All right, team, we did it. We may have an approval of the final recommendations. Great job. All right, now I'm going to move into Jeremy to wrap us up for next steps of what we can expect as a group, and then we'll move into closing comments.
Great. Thank you all. And again, and we talked about this in December, but thank you all for such an incredible amount of work and commitment over the last, I suppose it's been 14 or 15 months now, and lots of work ahead. I have already felt myself transitioning into, well, this is just another milestone on a long road we still have ahead to get this program launched, and really excited to keep working with you all throughout the year as we get going on this. In terms of next steps, we had talked about having the next meeting in February. We're going to push that out to March. We just recognize everybody's completely swamped, and we could be doing a little bit more prep work behind the scenes as well. So we'll start to build out a calendar for the year. We're looking at probably meeting every other month, try to keep those meetings fairly short to 2 or if necessary 3, but we're going to try to keep them to more like 2 hours every other month if we can structure agendas that way. There's a work plan that was in the email that shows kind of the general cadence of topics that we expect for the year. But so expect that our team will be reaching out, calendaring. We'll keep you up to speed as we get into the legislative process. As I mentioned earlier, as soon as we've got an amendment back on the bill, we'll circulate that with the group, and we'll work it through the legislative process. Trying to think about any other next steps I've got.
There's one more. We do plan to start the technical advisory group, hopefully late January or early February. So we will pick the first meeting, get that on the calendar, and then let you all know. You're welcome to join, or if you have other more hands-on data folks in your organizations that you'd like to participate, this will be a y'all come meeting. So no worries about getting us the specific list. We'll let you know as soon as we get that on the calendar.
And then the other final item is, we had slowed down the value-based payment work as we were trying to get through accountability. Now that we've got a final set of recommendations, we'll be picking that back up. I think I mentioned before, we had a placeholder bill in the legislature. We're not working that right now. It's just sort of sitting there. There's also a budget item from the governor's budget to provide some additional support to the agency around value-based payment that we do want to make sure we don't lose track of. But we'll be reaching out to you all over the next couple of weeks, probably sooner rather than later, to especially the payers and providers on the group, to basically get a temperature check of, is your organization ready and willing to sign a compact that embraces the value-based payment principles. So we'd started to make calls through folks before the accountability conversation. We're picking that back up, and I know there's several legislators that are kicking around other value-based payment concepts, and I've committed to them to trying to get a signal from folks this month on whether the compact's going to come together. So we'll a little bit of sense of urgency to kind of get a temperature check from folks sooner rather than later. So expect that call from me, but that'll probably be the biggest thing we'll be working on between now and the March meeting that you'll see.
Great, thank you for that, Jeremy. I see that Jack has joined us as our chair. I was going to make a couple really quick closing comments before I hand it over to Jack for final closing comments. But I had to kind of do a temperature check with myself when I was reviewing the recommendations, and cognitively, everything there made sense from what we wanted to try to accomplish as an implementation committee. But then I also had to address the feelings that were behind all this cognition, and feelings of a lot of pride with getting this together during a pandemic, during a wildfire season. And we really have something that we have to be proud of. So I thank all of you for that. But the other feeling that I had was now some consternation and a bit of fear with, okay, how is this really going to play out over time? Are we going to be successful? And this is where the rubber meets the road. So thank you for all of your participation over the last several months. I said this the last time that we met, but even when we disagreed on various parts of the recommendations, we all did so with grace. And it's for that I really thank you for being a great implementation committee that was forward thinking, could think throughout all of the different nuances we needed to do, but had very, very civil and correct conversations. And being part of the Oregon population, I'm so proud of what we collectively put together. So Jack, I'm glad that you joined us for our final comments, and I'll turn it to you.
Oh, Kevin, those are such lovely words. I don't think I could really say much more. I'm sorry I couldn't be on the call. I hope you people know, maybe Jeremy and Sarah shared that I'm down with my mother, who has COVID, and that's why I'm in the house, so I'm wearing a mask. And my only comment is just to say thank you for your wonderful work. Kevin said it so well. I think what I so respected was everybody put their own, personal stakeholder interest aside, and we got to the right place on this. I feel really great about the recommendations. I think the staff, we owe so much gratitude to Sarah and Jeremy and the team for advancing this work. Sarah, you made it really easy on us, particularly me, and I am grateful for that, because I needed that, let me tell you. And so just wish everybody well and to stay healthy. And I look forward to the next phase of this work. And I think our citizens in Oregon would be proud for the effort we put in. I wish our leadership in DC could follow this model, but they struggle, as we know. So wishing everybody well and thanking you all for your commitment and your goodwill.
And Megan and Michael, we couldn't do this without your collective wisdom and how you worked so hard for our group behind the scenes. I mean, we can probably never really understand the amount of work that you put into this for us, doing all of the research and putting together these recommendations. So thank you as well.
Yes, indeed. Thank you for that, Kevin.
All right. I think at this point then we can have a motion to adjourn. Would somebody like to make a motion to adjourn?
I'll make that motion.
I will.
Right.
Oh, you can't make a motion. You're the chair.
Oh, yes, I can. You're right. Thank you, Catherine.
Catherine's made the motion to adjourn. All in favor of adjourning this meeting of January 12th, say aye.
Bye.
Aye.
Aye. All right. Take care, everybody. Stay healthy.
Thank you, everyone. Be well.
Everyone, thank you.
Thanks, everybody. Thanks. Take care.